There are 40 amputations a day that are being performed in hospitals across the country. Canadians who are losing a toe, a foot, even an entire leg. And the single biggest culprit is diabetes. High sugar levels from both type 1 and type 2 can build up, triggering inflammation and damaging blood vessels and nerves. Calgary resident Harish Rangan paid a hard price as he lost part of one foot and another leg.
Yeah, when I see my leg, 52 stitches on it. Oh, and the total leg below the knees is gone. It's desperate. That time I was crying actually, yeah. And if you give up, give your leg, basically your life's totally gone.
A new report by the Canadian Institute for Health Information shows that diabetes is not only one of the most common chronic diseases in Canada, with numbers rising, there are also troubling signs that amputations are happening more often in people living in lower income areas, among those with lower educational status, and in rural remote areas. We'll hear from Calgary's Dr. Karim Manji, director of the Zivit Limb Preservation Centre, who says far too many are being diagnosed too late in the disease process.
Almost the entire foot can become numb to the point where, you could step on something and not know. For example, a needle. One time a piece of a chicken wing bone was also in a patient's foot who had diabetes that had no idea that they had stepped on something. They just noticed their cat chewing the other end of the chicken wing, which led them to believe that part of the bone was in their foot.
That is a disturbing picture for sure, and that's why this episode is so important. Hello and welcome to the Canadian Health Information Podcast. We call it the CHIP for short. I'm Avis Favaro, the host of this conversation. A note, the opinions expressed here don't necessarily reflect those of CIHI, but it is an open discussion, and this one is a disturbing picture about how doctors estimate there are up to 1 million Canadians out there at risk of complications that could cost them an arm or a leg or their lives. Joining us now from Calgary is Harish Rangan. Nice to meet you.
Nice to meet you, Avis.
Thanks for coming and talking about a very difficult subject because it's amputation, and you know this because you've lived it.
I know, yeah. I've been there and go through it last 3 years, almost 4 years now.
Yeah, I was talking to someone who said amputation changes everything.
Oh yeah, it changed your whole life. Yeah, exactly.
One of the reasons we're doing this is because we're looking at the number of amputations, especially those linked to diabetes. And I was looking at the numbers that CIHI has put together, and it's 40 amputations a day.
Oh, wow. I didn't know that, yeah.
Yeah, so that's 2 an hour somewhere in Canada. People
Somebody
are
got
losing a
amputated,
toe,
yeah. Wow.
a leg. Does that surprise you?
Oh, totally, yeah. I didn't know the numbers are that big, yeah.
Mm-hmm. When did you realize that you had developed type 2 diabetes?
I have a diabetes for the last 15 years, but the real time actually I find out after first 5 years, I didn't even know I have a diabetes because I have some symptoms, urinations and thirstiness and tired and everything. But I was working too that time, so I didn't notice that thing. I thought it's normal, right?
And so when you were diagnosed, then your blood sugar levels were very high.
Very high, yeah. Because sometimes I just got totally fainted sometime, couple times.
You fainted?
Exactly.
At work?
Not at work, at the house. Early morning when I get up, my blood pressure is really low and my blood sugar level is high. I get up and I'm just totally fainted, just fell down with 2 minutes and then I get up. So I thought, what's going on? Then I just go to the doctor and then he just did all my tests and everything. So then I realized I have a diabetes, yeah. So then he put me on medication and everything, and I'm taking medication since that, yeah.
And you were managing a convenience store.
Managing Max convenience store, yeah. It's called Circle K these days. So I was a dealer and manager there, yeah.
So long hours, lots
Long
of
hours.
stress.
Oh yeah, long hours. Stores are 24 hours. If you don't have any employees, so you're stuck working, even doesn't matter night or day.
Right. So let's go to the diagnosis. One of the things about the high sugar levels is that it ends up causing inflammation. It damages blood vessels. It damages the nerves. So some people don't even feel the
Right.
damage in their limbs that
Yeah.
might be happening. Did you have that?
Actually, yeah, that's true. It happened to me because I don't feel any tingling or anything. Like if anything's like just pinch me or something, so I don't feel any pain.
When did you notice there was a problem with the toe?
I see just like infection, like small, like I was going to the bath, spring natural water, and I just come out. So I just have like the rock actually just hit me my toes, and it just basically like a small knife, like small cutter, and that cuts start getting bigger and bigger, and it's getting infected. So the one whole toe is so big, and it tracks to the side toes too. Yeah, and when it's getting too much pain, it's hard to walk and everything, so it's getting worse. So then I just go to the emergency. Yeah. And
And you
then,
went.
and
And
I
what
went to the,
happened?
after that, they say it's got infected. Yeah. So this one has to go because if it's not, we don't cut it, then it's going to go over to the bones and then it's going to be like really hard. Yeah.
How did you feel?
I feel like that time really bad. And I said, no, 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 I don't want to cut it. You have to just do something, give me some antibiotic or something, but there's no other option. There's just nothing.
Save your life by losing a
Yeah, so
toe.
that's what I say. It's better to do it now. Otherwise, more you wait, it's going to get bigger and bigger, and then it's going to go to the bones and keep going up your body.
And then a year and a half later, not
Even up.
very long, much afterward, there's a
Yeah.
problem with your leg. Where did that start and
It
why?
actually starts
Yeah.
on my feet too. And same thing, like, it's just got little pimple, and then the pimple getting bigger, and it gets swollen so big. My feet look like almost times 4 size. Go to the hospital. When I go to the
Emergency.
hospital and they say, yeah, it's infected, exact same story again. And they say, no, this time we cannot do anything. You have to cut the leg. So
Oh
I waited
my.
for at least 5 days to just keep saying no, no, no. And they keep sending me
Why
different
did you say
doctors.
no? Why did you say
Because actually
no?
I thought it's my leg because living without is so hard. And if you give up, give your leg, basically your life's totally gone. Basically, like you cannot do anything, cannot walk. Your totally whole lifestyle change.
When you woke up from the operation and you had to feel your leg,
Oh yeah, that's the worst scene. Yeah, when I see my leg, 52 stitches on it. Oh, and the total leg below the knees is gone. It's desperate. That time I was crying actually. Yeah.
I bet.
Yeah.
I'm sympathizing with you at this moment. I
I
can
know
feel it.
that's the worst moment for my whole life. Yeah.
Have you accepted that this was the price to save your life from diabetes and the damage that it caused?
Yeah, I accept it. You just want to live or you want to die. Basically, if you want to live, so that's the option. You have to do it. So doctors, whatever the doctors say, you have to do it. And then I accept it.
Do you think it's changed the way that people look at you?
Yes, totally.
In what
Because
way?
now the same people actually, they just feel like a little bit sorry type for me and then try to help me more. It's not like the same when we just like the friends, just do whatever you want, let's do there. But now they just kind of like slow down and don't tell me, let's go on holiday or do this, do that. Like it's going to be hard for them to just handle with me because now I'm slow and everything.
So the other question that I had, Harish, is how has it affected your ability to work? Are you able to work? Can you do that job or are you on disability?
No,
What was the economic consequence of what
oh,
happened?
the economic concept is bad, yeah, because working the job that when I was doing it, same thing, it's hard. You cannot do the same job. And it's basically you cannot stand too long, you cannot walk, and you get tired too much.
So
So
are
you're
you
like
working?
basically really, no, I'm not working right now. No,
It's hard. It must be really
yeah,
hard.
it's really hard. Yeah, because it's pretty hard. I tried so many places, but it's hard. Everybody just say we have this is our requirement. So if you can't do it, so it's hard.
Do you worry that you might end up having another amputation?
I hope not, but it still worries. Yeah, I'm worried. Yeah. But I actually take really good precaution right now. Watch my beat all the time, do my medication, watch my sugar, watch my blood sugar level all the time. If you don't do that, it's no chance you're going to lose it again. Yeah. So you have to be like on the top all the time. Yeah.
I can't thank you enough, Harish, for
Oh,
talking
no
about this.
problem. Anytime.
It's a
Yeah.
hard it's a hard topic because you've lost part of your body to this disease.
I know. Yeah, that's right. But life goes on. Yeah.
Doctors tell us that about 80% of these amputations related to diabetes are actually preventable, with regular foot checks to catch wounds early and then fast access to medical care if an infection sets in. Our next guest, Dr. Manji, heads the Zivit Limb Preservation Centre at the Peter Lougheed Centre in Calgary, and he's going to talk about how his team is trying to save limbs literally, one toe at a time. We're now joined by Dr. Karim Manji in Calgary as well. Welcome to the show.
Thank you for having me.
So we just finished talking to Harish, who is one of your patients. What we learned is that he seems to be one of the many Canadians who are getting diagnosed with diabetes late. There's a delayed diagnosis. And is he an example of what's happening across the country?
Harish is a patient who has diabetes, who's lost feeling in their feet. And sometimes patients with loss of feeling would develop a wound. And in his specific case, developed a pretty bad infection, and it resulted in a major amputation on one side. Prior to that, he had actually developed an infection in his other foot, in his right foot, where we were able to save his limb by just removing the toes. And so maintaining that ankle joint was a huge success from our standpoint, in that it allowed him to maintain some independence, his ability to continue driving, and his quality of life.
So if someone has a foot infection, how long usually has the diabetes been there, not well controlled?
I would say many years, many years.
So what is it that's happening when someone has diabetes that's not recognized or treated? What's going on in the body that leads to this?
Ultimately, the diabetes and the elevated blood sugar is causing some type of damage to the nerve, resulting in numbness. And it's what we would call peripheral neuropathy. So almost the entire foot can become numb, to the point where, you could step on something and not know. For example, a needle. I've taken out a number of needles from patients' feet over the years, who stepped on a sewing needle at home and didn't know, but just noticed the blood on their floor. One time, a piece of a chicken wing bone was also in a patient's foot who had diabetes, that had no idea that they had stepped on something. They just noticed their cat chewing the other end of the chicken wing, which led them to believe that part of the bone was in their foot. So the numbness is profound.
Harish was 51. You normally think of amputations going in the 60s and 70s, older people. What's the age range?
I think it's that 50 to 65 age group that we're seeing more and more in our clinic. One, they're continuing to work. They're unable to potentially offload their foot in order to help it heal. So the ulcer remains open. We're seeing these patients sometimes having difficulty getting the medications they need to help control their diabetes. So it does affect a certain demographic in terms of a socioeconomic status in our society.
Data was showing 3 times more men who are ending up with amputations than women.
I think part of it is how often maybe men would go see the doctor to say, hey, I don't feel good. Perhaps it's something's going on, or the stigma around having someone look at your foot to see why it's bleeding, or there's a blister, or why there's an open sore.
You also brought up that it's 3 times higher among those living in lower income communities and people with lower levels of schooling. Those were 2 other findings in the report by Kai. Have you noticed that trend too?
Yep, I would agree. Perhaps the occupations that these patients would have to be doing would be more physically demanding, perhaps putting more pressure and force on their lower extremities, resulting in a wound. So we see a lot of patients who are truck drivers, a lot of people in construction, a lot of people in the trades who are working on their feet. We're fighting the fact that every step they take on that wound prevents it from healing and perhaps ultimately could potentially get infected. So how do we maintain the patient's quality of life, their ability to work, help them heal? If they undergo an amputation, how do we save as much of the limb to allow them to function back into society and into that occupation?
One of the things I've been hearing through the sort of the medical community is that there seem to be more amputations being done. It's reflected certainly in the CAI data. We're up to total 14,000 in the last year, which I calculated to 40 a day across the country, right? There may be more being done, more amputations being done because there are fewer family doctors catching it early, not enough ways of monitoring people who might have injuries or wounds on their feet. Do you get the impression that some people are doing the amputations because it's easier and faster?
I think the rise in amputations is partly due to the fact that there's less surveillance from family doctors. I think part of it is due to the fact that access to care is limited. So perhaps someone living in a rural part of Alberta, let's say, for example, by the time they end up at a tertiary center in Edmonton or Calgary, the only option that remains is an amputation and perhaps a major amputation. But I think the other part is what we've noticed here in Calgary is that our amputation rates have continued to climb over the last decade, but the ratio at which type of amputation is different. We have started to do much more toe amputations and partial foot amputations, and as a result, it has reduced the need for a major amputation, which is below the knee or above the knee. And that's there's a huge difference in quality of life, mobility, complications, and even life expectancy for someone who's had a minor amputation versus a major amputation.
Amputations are costly. So the data is showing that it's between $25,000 and $45,000 per patient who has something amputated. But it's also got to be costly emotionally for the patients. Harish was talking about depression, how he can't do things. What do you see is the effect of all these amputations on people?
I think that one of the biggest things patients will say to me is that they've lost their independence. Some of the researchers who study amputation prevention feel as though losing a limb is so profound because they feel that when we evolved, before we came out of the trees, our brains were developing. So the limb was such an important part of our evolutionary process. And so people feel that, they can't actually wake up in the middle of the night and walk to the bathroom because they have to find their prosthesis to put on in order to get there. They may not be able to drive or perhaps wear a pair of shorts without that stigma. So the feeling is that there's a loss of independence. There's a loss of losing a part of your body that you were born with. So feelings and things like depression do set in and hopelessness sets in.
Okay. There's also a higher risk that these patients who have the amputation will die. We filmed a story a while ago, and the patient had a limb on one of his legs taken off, and I heard that about 3 weeks later he died. There's a risk.
Huge. After having a major amputation, the life expectancy drops drastically. Having a diabetic foot ulcer, just a wound on your foot, your life expectancy is 50% in 5 years. And it's not the ulcer that's potentially the cause of death, but it's the sign that the diabetes has taken a toll on the human body.
And before we leave the stats, one of the other findings that is very troubling is that among the homeless, there was almost a 4 or 5 time increase in the number of homeless people and those with frostbite who are having amputations. And I know Alberta has been quite hard hit by this. Are you seeing it?
Huge. The challenge with patients who generally have suffered frostbite is that they don't have the neuropathy that a patient with diabetes would have. So now the tissue loss and infection is very, very painful. Even being in the hospital, it's very hard to control their pain because their nerves are still working. So this population, we've seen a dramatic increase in the number of amputations from frostbite over the last 2 years here in Calgary.
You're trying an approach to save the limbs. You're trying to say, okay, if someone has a wound, how do we make it the safest possible for their limbs? What is it that you're trying to do, and what are you finding with your team?
So what we have done here in Calgary is developed a team based on the global guidelines around the diabetic foot. And that includes a foot surgeon and a vascular surgeon as the backbone of that team. And our goal is to detect early on the ulceration or wound and get it to heal as soon as possible. Unfortunately, sometimes patients will come in with an infection that is too far gone, perhaps gone to the bone, has caused a lot of damage in the foot. And so at that point, our goal would be to remove the infected tissue and provide the patient a functional foot to walk on.
So what does that mean? Not amputate, but take away just the infected part.
Just the infected part, but to leave them with a functional foot. So there is a understanding the mechanics of the foot and where the tendons are and where the bones are and how they function provides the ability for the foot surgeon to determine how a foot would function with part of it gone. So in some cases, that would require removing all of the toes or removing the metatarsal heads, which is a transmetatarsal amputation.
You would take off the front half of the foot?
The front half of the foot. And that's what Harish has. And he still has his ankle joint. He still has his major hindfoot joints. And he's able to walk, and he's able to walk in a regular shoe with an insole that has a little bit of cushion at the end of his foot. It allows him to walk with less strain on his heart. Once we've removed the leg below the knee, your cardiac demand rises. Our goal at our center is how do we preserve the limb and make sure that it continues to have a function for the patient so that it maintains their independence, reduces the strain on their heart, and improves their quality of life. Sometimes it's not removing all of the toes. Sometimes it's just removing 1 or 2 toes. There's a lot of different surgical options to help save the diabetic foot, depending on the specific scenario.
Yeah. You called it toe and flow.
Yes. So toe and flow is a term that was coined by David Armstrong, who is one of the global leaders in the diabetic foot. And they found that the toe and flow model was one of the most effective teams. And the toe stands for the podiatric surgeon, which is the foot surgeon. And the flow is the vascular surgeon, or the one who helps reestablish blood flow. And so the toe and flow model is what our clinic is based on.
And you're the podiatric surgeon, which a lot of Canadians probably have never heard about. What is that? You're a physician, you're a surgeon, and it's a unique specialty.
Yeah, so I'm a podiatric surgeon. I pursued my podiatric training in the United States. And so this is a unique profession. It's not something that exists throughout Canada. It really does only formally exist in places like British Columbia and Alberta. Alberta has a publicly funded model that allows for that access to care. And we're showing that an investment in this specific specialty has shown to improve outcomes for patients with diabetes.
So tell me what the results are, because you've been testing out this team approach.
So what we found is we looked back about 10 years into the number of amputations that were done in the Alberta Health Services system. And so we looked province-wide, and we found that in Calgary, with the toe and flow model, we were able to reduce major amputation rates by 45%. That's huge.
It's huge.
Our most recent study showed that along with reducing major amputations, we were also able to reduce the number of hospitalizations that patients with diabetes would have. So a 30% reduction in hospitalizations. If you did get admitted to the hospital, your length of stay would be reduced by 21%. not only are we saving the limb, but they actually stay in the hospital for a shorter period of time compared to other places in Alberta.
What about other places compared to other places in Canada?
It's difficult
Because
to...
there are different programs that are being tested out with slightly different approaches in Toronto and Quebec.
Right. I think the difficulty from my experience has been we don't really have a clear way of collecting the data across the country. And I think that's what CIHI has really helped us clarify. If we compare our delivery of care, our model, to other places in Canada, I would argue that the best way to do that would be to check our high-low ratios.
What is high and low amputations?
So the high-low ratio is basically the number of high amputations, which would be above the ankle, divided by the number of low amputations, which would be below the ankle. That number will show or demonstrate how often a patient is undergoing a major amputation compared to a minor amputation.
Are other jurisdictions interested in following what you're doing?
Very interested. So right now there's the development of a toe and flow center in Edmonton. So it's expected that they'll open their center in Q1 of 2025. We've had discussions with the University of Toronto, some of the vascular surgeons at the University of Toronto. We've talked with the vascular surgery department at the University of Ottawa and looking at ways in which we can create toe and flow teams throughout the country. I think the realization is this is what we can do to help reduce major amputations.
And how are we doing right now based on what you see? Not so good.
Not so good. I think we can do better here in Canada.
I think Canada scored 14th out of 24 countries with universal health care in terms of the rate of amputations. We're sort of in the bottom half of that. Are we missing the ball? Are we not taking this seriously?
I think the seriousness is there. I think that the solutions that are available have been, I think, maybe not investigated to the fullest extent. I think we have a solution here in Calgary that needs to translate throughout the country. Why is it that Edmonton and Calgary have such a drastic difference in amputation rates? I think that toe and flow model speaks for that.
So let me just delve into that. Your amputation rate is what, and what is it in Edmonton?
So Calgary has a 45% lower major amputation rate than Edmonton. So if you have diabetes and you live in the Edmonton zone, you're 45% more likely to lose your limb to diabetes below the knee. Like you're gonna have a major amputation below the knee, not save your limb. So Calgary is speaking for what can be done. Edmonton is the standard of care, and that's kind of what we talked about in our study, is that the Canadian standard is what Edmonton's doing. Edmonton is providing all of the access points to vascular surgeons, to pharmacists, to family doctors, to medications. They have the same demographic. So why is it that in Calgary our amputation rates are lower?
And you say,
and I say
it's the toe and flow,
and particularly the toe portion of it.
So some might play devil's advocate and say, well, you're promoting your profession. Not everybody has one of you. Not everyone has a podiatric surgeon on team for whatever reason.
That's a good question. And so the Alberta Health said, that they would like to study now, once creating a toe and flow model, if it does have an impact on the reduction. So that will be even a stronger case, or dispel the rumor that we are actually making a difference.
Just, I guess, to wrap up, you are proposing another way of dealing with this, and you have the platform in Alberta to proceed with it, right?
So we've been looking at this problem for a while, and we understand that there's different barriers to provide access to the care we provide. And so we're trying to find solutions to help different places start toe and flow teams. What we found is that the biggest gap for our side is where do you find a podiatric surgeon? You can't just go get one. So we've started a fellowship. So the fellowship allows for American-trained podiatric surgeons to come back to Calgary, train for a year, learn how the toe and flow model works, and hopefully take that to another place in Canada. So we just graduated our first fellow. We have a second fellow that's currently in his training, and hopefully he'll be part of the team that goes to Edmonton. So There's a lot of interest around recruitment of our fellows to different parts of Canada. That's part of how we're hoping to contribute to the solution around the toe and flow model teams. And then, continuing to build bridges with all the different partners involved in limb preservation. Wounds Canada, Diabetes Canada, the Canadian Podiatric Medical Association, CIHI, all the universities. I think all of these people are stakeholders that can help share the message around limb preservation.
Okay. I guess my last question is, where do you get your payoff? What, at the end of the day, what gives you the greatest sense of satisfaction in a very hard profession? Because you're talking about people losing their body parts here. What gives you the most satisfaction?
Some of the most happy moments are where a patient heals a wound that's been struggling for months and is able to get back into a normal pair of shoes. This patient was on the edge of potentially getting an infection and an amputation, and we were able to prevent that. And now they can return back to their normal life with more information and more tools to prevent this from happening in the future. It makes me feel very satisfied with the work I do. Very
Good.
honored to be part of that patient's life.
All right. We'll leave it there. Thank you so much, Dr. Manji. Appreciate it.
Thank you.
You'll recall in his interview, Dr. Manji noted about the patients he sees who just can't afford those diabetes medications to keep the disease in check. And that is one of the reasons why the federal government says it is working to make essential diabetes medications free as part of its first phase of a national universal pharmacare program. And remember, diabetes doesn't just lead to lost limbs, it also can cause blindness, kidney failure, and heart disease. If you want to learn more about the Advancing Equity in Diabetes Care report, you'll find the entire document online at cihi.ca, along with much more information on the work CIHI is doing on equity in healthcare. Thank you so much for listening to this important episode. Please subscribe to The Chip wherever you get your podcasts. I'm Avis Favaro. Talk to you next time.